All right, here we go now. It's time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. And today it's all about the neck, right?
All about the neck, right here.
Right here. All right, let's go ahead and get to our first question, which asks, I have this persistent redness on the sides of my neck, and it looks like sunburn, but I'm never in the sun. What is it, and what can I do to get rid of it? George in Lakeside, let's go ahead and put up the picture right there. Yeah, it does kind of look like a sunburn, doesn't it?
Yeah, it looks really red, and you can actually see some pebbly-like texture changes. And this is classic for years and years of repetitive sun exposure. You know, it only takes a few minutes a day of sun exposure to actually cause radiation damage to the skin, and that's exactly what that is. That's why it looks so red. Sometimes it can get a brown discoloration. And what it is radiation causes damage to the skin that causes the blood vessels to come to the surface and dilate. So that's why you get this persistent redness. But we can treat it with lasers to make it cosmetically look better. And I think we have an example of a patient that yeah, here you go. So you can see she has the same thing. This is called pelicula derma of Safat, a big medical term, but basically it means radiation damage to the neck. And like I said, this can be seen from repetitive sun exposure through many years. It's interesting, if you look at her photo, right underneath the chin, the skin looks relatively normal, and that's because the chin acts as a protective, almost like a shelf, and that area under the chin doesn't get the sun exposure that the sides of the neck
Interesting.
get. Yeah.
All right, let's get to our next question. I've tried all kinds of creams, and nothing seems to help my razor burn on my neck. Can you please help me? Steve from Carlsbad wants to know. Here's what we're talking about right here. This is a common problem for a lot of men.
Yeah, and especially it's exacerbated or made worse by when men have to wear suits and ties and things that rub on the neck. It causes the
Or military uniforms.
Yeah, exactly. So, and in fact, when I was in the military, in the Navy, we did a bunch of studies using lasers on the neck to get rid of, if you get rid of the hair follicle, the problem disappears. So for these guys, I like to say, hey, look, we'll do hair removal treatments on the neck, get rid of the hair, problem disappears.
Goes away.
Yeah, it's great.
Okay, very good. Next question. Oh, and we have an example right there of something that had done.
This is actually a guy that I treated when I was in the Navy, and you can see, look how bad that those ingrown hairs are on his neck.
Yeah.
Now, he wanted to keep his goatee, so I did laser on the rest of his neck. You can see you get rid of the hair, get rid of all those bumps and those growths and all that build up skin. So.
But he can still have the little chin part if he wants
we
to
let him keep that.
Okay, next question. Ever since I was little, I've had this stretchy skin on my neck, and my joints are super flexible and bendable. Is that normal? Stu from PB. Oh, mercy.
Wow.
Look at there.
That's impressive. If you think back to, in time, back to the 1920s, you remember when in the circuses they've had the guys that would have the real stretchy skin and they'd be able to like turn themselves into a pretzel? Well, this is probably what this gentleman has. It's a condition called Ehlers-Danlos syndrome. It's genetic and it can be passed down from family member to family member, but it makes their skin hyper or stretchable. The joints can be bent like in positions that you and I couldn't get into. And there is some concern because these patients can have problems with their heart and with their blood vessels and things, so they really need to be seen by a doctor.
Okay, very good.
Yeah.
Next question. I work out and my body weight is normal, but I have this stubborn fat in my neck. What is the easiest and most efficient way to improve this? Edward from La Jolla wants to know. Oh, it's almost like a double chin, kind of.
Yeah. And that's usually just a collection of fat under that area, and that can happen with age, and of course if you don't exercise and maybe not eating properly, but you see in patients who are ideal body weight too. So, but it's so easy. What we do is we numb the area and we go in with a tiny cannula and we can literally suck the little fat cells out, and it makes a dramatic difference. And it's a procedure where patients are awake, can be awake, and they drive themselves home, and it probably takes, this patient took about 15, 20 minutes to do that.
Wow.
So it's pretty amazing.
Next question. I've been eating more lately and not exercising enough because I've been cooped up. The appearance of my neck is driving me crazy, and I want to look best for Thanksgiving dinner. Tom from Julian wants to know.
Oh, Tom. Wait, I'm not a veterinarian, although, I've played one with TV once, but his neck. I don't know if he knows what Thanksgiving is. We might have to tell him.
I don't think we should.
He may want to avoid Thanksgiving dinner, but we do have some really cool software at our office, so I can show Tom what I can do to his neck. So just a little bit of work, and look how much better he looks.
Wow, it literally took 10 years.
Yeah.
I mean, I would not even recognize him. Is that the same turkey? I don't even know. I don't even know.
I think we need a separate conversation with him about Thanksgiving, though, and he may want to go to like Cancun or something.
Oh, I was not expecting that. You surprised me. Well done. All right, to get in touch with Dr. Groff, we're going to put the information up, I think. Here we go. Here we go. It's right up on your screen right there. We've also got it on our website, fox5sandiego.com. Raul?